The nation's blood supply used in surgeries or other emergencies now at a critically low level. Chris Hrouda is the president of the American Red Cross Blood Services. Chris, good to have you with us tonight.
Thanks, Scott. Appreciate having me on.
Why is the supply so low?
We've seen unprecedented cancellations from our sponsors across the country since the COVID crisis hit. We've had over 30,000 blood drives canceled and about 800,000 donations not collected as a result of those cancellations.
Those are both large numbers. Do you have any idea when you can start back up?
Yeah, I mean, we're working hard. And part of what we're doing right here on this call is we're working hard to get folks aware of the shortage that we have across the country, come out and donate. It really is an easy process. We just need people to step up, come out. We've made the process very safe. They can safely come into our organization and donate, and hopefully people will hear the message and come out.
Is that what you think the biggest issue was? People were just afraid to come in and donate blood?
I mean, mostly it is, again, the locations that we would normally go, colleges, high schools, faith-based organizations, businesses, corporations. As you know, of course, people aren't in those locations as we speak. We've seen the public come out in pretty strong numbers over the summer or over the late spring and beginning of the summer, but hospitals have really driven up the amount of blood they need. We've seen about a 30% increase in the demand for blood over the last several weeks. Combine that with lower than normal donations, and we have a severe shortage.
Simple economics, demand outpacing supply. Part of this, I would suppose, this virus is so unknown, and it has a devastating impact on a number of organs in the body. It requires, in some cases, transfusions. Is that playing into a role as well, that these hospitals are just using their supply in the way that they are being forced to treat COVID-19?
COVID-19 is not a big user of blood products as a respiratory virus. We don't see a lot of that, right? Again, I think principally what we're seeing is the backlog of surgeries that were canceled for months as a result of hospitals pulling back on those procedures to make room for potential COVID patients, as well as just the risk of having those patients in the hospital. And we're just seeing a lot of hospitals across the country begin to do those elective and scheduled surgeries again, and that's just pushing demand back up.
What about the issue of antibody tests, which I now understand the Red Cross is getting involved in?
Yeah, actually, starting today, all blood donors to the American Red Cross across the country will receive a COVID-19 antibody test. We hope this will provide donors with some information about their health status. At least if they're negative, they'll know they've not been exposed. And we also think this might be of use to health departments, local and state health departments across the country as we get a lot of data. We see 13,000 donors a day. So we'll get a lot of information, a lot of data about prevalence or at least from a blood donor standpoint that we'll be able to share with public health officials.
It sounds from the notes that you don't expect this situation, Chris, to get better anytime soon, that your sort of worst case scenario planning is a year out. It could take a year to have the level of blood drives and donations that you're used to. Is that right?
Unfortunately, yeah, it's the case. I mean, we're hearing, for instance, a lot about schools and colleges and high schools. About 20% of our blood comes from colleges and high schools. We're hearing this fall that a lot of those locations and organizations may not be back on campus, or and if they are back on campus, they may not allow blood drives. We know some businesses, as I've heard just in some of the notes coming up on the call, right, are won't be there in the future. Corporations are doing businesses in different ways, more people working from home. We just anticipate we're going to have a long-term problem with the way we've historically collected blood.